Welcome. Today we'll focus on simple communication strategies that can make caring for someone with dementia easier and more positive. This training is part of our continued partnership between UIC and CASL, and we're so glad you're here. You'll all play such an important role in supporting older adults every day, and today's goal is to make that work just a little bit smoother through effective communication. When we say communicating with compassion, we're talking about more than just the words we use. It means remembering there's a person behind the dementia, someone with feelings, a personal history, and dignity. Compassion shows in the way we speak, the tone we use, or facial expressions, and our patience. When we meet the person where they are, instead of forcing them to meet our pace or expectations, we can reduce stress, preserve trust, and make daily care activities go more smoothly. That's the mindset we'll use for everything we talk about today. By the end of the session, you'll be able to do three things. First, recognize common triggers for dementia-related behaviors. We'll talk about what tends to set off confusion, frustration, or agitation. Second, you'll learn ways to use your words, your body language, and simple cues to communicate more clearly, reduce frustration, and build trust. And then finally, you'll get to practice these strategies in real-life care activities, like helping someone get dressed, washing their face, or assisting them safely after a fall. So after this short video, we'll first go through a few key communication tips together, and then move into hands-on practice in small groups. So before we dive in, let's watch a short video from Hong Kong. It's in Cantonese with English and Chinese subtitles. Even if you don't understand Cantonese, notice the body language, tone of voice, and how simple cues support the interaction. The video will also highlight strategies we'll be practicing today.
屋企有患有認知障礙嘅老人家，其實對於長者同埋照顧者都有好大嘅挑戰。你有冇遇過呢一啲情況呢？
媽，你去邊啊？
哎呀，我去買生果啊！
你今朝咪買咗咯，唔好成日話要去買生果先得㗎。嗱，你而家坐定定，唔好周圍去，因為表姨媽咧嚟陪你，同你去飲茶㗎啦。我趕住返工啊！
你唔好咁大聲啦，我好驚㗎。
啊，好啦好啦，嗱你唔好周圍喐啦嚇。啊，仲有啊，因為表姨媽同你飲茶咧，你諗住着咩衫啊？
着咩衫？
啊？
我唔知喎。
啊，係啦係啦，你來來去得嗰幾件嘅啫，我同你揀一件啦嚇。
乜你咁惡㗎？我唔乖睬你啊！
其實同患有認知障礙嘅老人家溝通，只要掌握以下幾個方法，就會變得順利好多㗎喇。首先，對話嘅時候要先稱呼對方，可以試下用佢喜歡嘅稱謂。
你媽
啊，文仔咩事啊？
你腳仲痛唔痛啊？
好好多啦，唔痛啊，唔痛啊。
你冇咩啊嘛？
溝通嘅時候要多啲眼神接觸，俾佢知道你正同佢講緊嘢，亦都要多啲笑容，保持態度溫和。喺適當嘅時候俾啲身體接觸，可以輕輕掂下佢嘅手臂、手背等等。保持說話簡潔易明，用簡單直接嘅語句，每次只係提問一個問題，並且俾佢有足夠嘅時間回答。
媽，今日我放假，帶你去公園行下。
好啊，好啊。
要善用實物、圖畫、文字、表情、手勢等等，令到對方更加容易掌握你嘅溝通內容。
媽，今日涼咗好多啊，要着翻件外套啊。嗱，呢度有兩件，你中意邊件啊？
呢件啊。
好啊，咁啊仲有呢件咯喎。嚟。
每次唔好俾太長同埋太複雜嘅指示，將步驟細分，亦都要多啲留意佢嘅非語言信息。適當嘅時候要俾多啲讚賞佢哋啊！
我幫你，唔緊要乜嘢啦，咁樣。嗱，首先你左手伸嚟呢度，好冇？伸落嚟係啦，呢度係啦，伸嚟呢邊係啦。 好，隻手係啦，啱啦，啱啦，隻手去。OK，OK，好啦，跟住嚟喺我呢邊嚇，小心啊！隻右手係啦，隻右手。
哎呀，好緊啊！
係啦，
好緊啊！
得唔得？
好緊啊！乜個心咁緊㗎？
係啦，啱啦，啱啦。哦，得啦，好叻喎！今日著得好快手啊！係啦，係就係咁啦。
最後記得唔好當面批評，又或者指出佢哋嘅錯處，亦都要避免同佢哋爭論啦。
哎呀，死咯！我個銀包仔呢？我唔見咗啊！我袋咗喺度㗎。扮咗唔知。哦，梗係個工人姐姐偷咗我嘅，見咁鬼靚，唔係啊！如果唔係點會唔見啊？
個銀包你好中意嘅喎，
梗係。
咁我幫你揾下嚇。
好靚㗎，紅色㗎。
放心。係咪呢個啊？
係啊，係呢個，好中意㗎。
咁我哋而家可以出門口㗎咯喎。
其實同患有認知障礙症嘅老人家溝通，只要肯俾啲耐性，用心去了解佢哋嘅需要，明白佢哋遇到嘅困難，就會順利好多㗎啦。
So good communication is really at the heart of caregiving. The way we talk, listen, and act can make a big difference. It can calm someone, lower stress, and make daily care go more smoothly. For caregivers, it builds trust and helps reduce challenging behaviors. For the person with dementia, it helps them feel safe, respected, and understood. So when communication goes well, it doesn't just make the task easier, it strengthens the relationship. That's what we're really aiming for today. So almost everyone with dementia will show some kind of behavior at some point. And these behaviors are really a way of communicating. Some people might ask the same question again and again, and others might seem restless, pace, or become upset. Some might call out, refuse care, or wander, and others may withdraw and seem to shut down. These behaviors aren't random. They're often the person's way of telling us something when words are hard to find. So our job is to figure out what they're trying to communicate. So next, we'll talk about what might trigger these behaviors. So again, there are usually reasons behind a behavior, and we can group them into three main areas: the person with dementia, the caregiver, and the environment. First, things happening inside the person. Maybe they're in pain, tired, hungry, or too hot or too cold. They might feel anxious, frustrated, or even just bored. Next, things might be related to the caregiver. Our own stress, health, or communication style can have a big impact. For example, speaking too fast or giving too many directions at once can overwhelm the person. And finally, the environment. Noise, clutter, lighting, or temperature can all play a role. Even a small change like turning down a TV or dimming bright lights can help someone feel calmer. So when we notice a behavior, it helps to step back and ask what might be going on inside the person, with me as the caregiver, or the environment. Sometimes when caring for someone with dementia, we might see behaviors that feel confusing or even challenging. Instead of reacting right away, it helps to pause and try to understand what's really going on behind the behavior. Here's a simple 3-step way to think about it. Step 1, what is happening? Start by just describing what you see. For example, is the person refusing care, pacing, or looking upset? Step 2, why is it happening? Try to figure out what might be causing it. Thinking about 3 areas. Is it something inside the person? Is the person in pain, hungry, or being tired? Or is it something about how we're approaching them? Is it our tone, words, or body language? Or is it something in the environment? Is it too noisy, too hot, or too cluttered? So Step 3 is what can you do to help? Once we have a guess about what's causing it, we can choose a response. Maybe use a calm tone, offer reassurance, break tasks down into smaller steps, or redirect to something comforting, or make small changes to the environment. We'll come back to this framework later during the practice stations, and for those of you observing today, this will also be a great tool to help guide your reflections. Now that we know why communication matters, let's look at the 3 main ways we can communicate effectively. First, we have communication with words. This includes short, simple sentences and giving clear choices so the person knows what to expect. Second, there's communication without words, using your body, language, facial expressions, or gentle touch to show warmth and reassurance. And third, we use cues. These can be verbal, visual, or tactile, helping to guide the person step by step through a task. We'll go through each one with examples you can try in your daily care routines. Effective communication is one of the most important skills when working with people who have dementia. Using words the right way helps create a calm and supportive environment that reduces confusion, anxiety, and agitation. First, speak slowly and clearly. People with dementia often need more time to process what you're saying. After giving an instruction or asking a question, pause for about 5 seconds before expecting a response. Rushing or stacking too many directions together can lead to frustration. In other words, say one thing and then wait. 2. Use short, simple sentences. The simpler your words, the easier they are to understand. Instead of saying something like, "Are you hungry? I made you breakfast. Let's go eat." Try something shorter and direct like, "Time to eat congee." Simple sentences help reduce confusion and make your message clear. Number 3, give one step at a time. Break down your instructions into small single steps. For example, stand up, pause, and then hold the chair. This helps the person follows your direction one step at a time instead of feeling overwhelmed. Number 4, be specific and direct. Avoid vague phrases like, "Let's get ready" or "let's get dressed." Instead, say exactly what you mean, like, "Put on your jacket," or "brush your teeth," or "wash your face." When you're specific, the person knows what to do next, and it helps build confidence. Number 5, offer simple choices. Giving choices helps the person feel involved, but keep it simple. No more than 2 options. For example, instead of asking, "What do you want for breakfast?" say, "Do you want eggs or oatmeal?" Limiting choices reduces decision fatigue and keeps communication clear. Number 6, call the person by name and introduce yourself. This helps the person recognize who you are and feel safe. You can say something like, "Hi, Mrs. Lee, it's David, your home care aide." This small step helps them focus and connect your face with your voice. Number 7, encourage with calming words. Your tone of voice matters just as much as the words you say. Use phrases like, "Good job," "Take your time," or "Everything is okay." Calming words can reduce anxiety and help the person feel supported. Avoid arguing or scolding or saying something like, "Why are you being so stubborn?" Negative or critical words can easily upset someone with dementia. So when you speak, keep it short, clear, specific, and calm. Simple, supportive words go a long way towards building trust and smoother daily care. Our body language speaks louder than words. Always approach them from the front so you don't startle them. A smile or calm eye contact can reassure, while frowning or rushing can make someone uneasy. Move slowly, give them time to follow. A gentle touch can comfort, but it's never about pushing. It's just to show you're there. And remember, not everyone likes touch, so always notice how the person reacts. Cues are signals that guide the person step by step. We usually begin with verbal cues, which are short, simple direction-like. For example, stand up, pause, hold the chair. You can also prepare them before movement. I'll count to 3, and on 3, we'll stand together. If verbal cues aren't enough, add a visual cue. Point to the chair, holding up the toothbrush, or using photos and signs like a picture of a toilet on the bathroom door. If the person no longer responds to words or visual alone, then tactile cues can help. For example, a light tap on the elbow can guide an arm into a sleeve, or you might use hand over hand to start brushing teeth. Always give time between each step. Rushing can frustrate them, but laying cues gently, one at a time, reduces stress and helps the person feel secure. Many times you'll see a combination of these strategies together. The best results come from combining words, body language, and cues. For dressing, you might say, let's put on your shirt, hold it up, and point to the sleeve, then gently guide the arm if needed, all while moving slowly and reassuring. Good job, take your time. For repeated questions, don't just answer over and over. Say, yes, lunch is at 12, then show a note as a reminder. Can reassure them and redirect to something simple like folding towels. That way, you ease the worry, not just the question. And if they refuse care, give choices. Shirt or sweater. Show the options. Guide one step at a time and keep your voice calm. It's okay, we'll go slow. Using these strategies together helps the person feel safer and more supported and makes care easier for both of you. You'll use these strategies all the time when helping with dressing, grooming, walking or transfers, meals, and even after a fall. We won't practice every situation today, but we'll focus on a few examples, like dressing, grooming, and responding after a fall. So you can see how the same communication techniques apply across different parts of care. Here are some extra tips to make transfers smoother and less stressful for individuals with dementia. First, before and during the transfer, explain what's going to happen. Use calm, simple language. For example, we're going to stand up now, and I'll help you. Give gentle prompts, like a light touch on the arm or shoulder, can sometimes be more effective than words. Physical prompts can gently guide them through the transfer when they might not fully understand verbal instructions. Keeping eye contact helps them stay calm and feel reassured. And encourage even small efforts, like pushing from the chair. Make sure the area is clear. Move slowly, and if you have a gait belt, use it for safety. Work together. For example, we can count together 1, 2, 3, so you can move as a team. And if you see any signs of discomfort or pain, stop right away. Safety always comes first. Meal times can sometimes feel overwhelming for someone with dementia, but calm communication makes a big difference. Use simple, specific language. Instead of just saying, eat, try, take a bite of your apple, or take a sip of water. Offer choices. Would you like rice or soup first? So they feel some control. You can also show what to do by taking a sip or bite yourself. If needed, use a light touch to guide their hand, but only as a gentle cue. Watch for swallowing difficulty and encourage small bites at a slow pace. Keep the space quiet and simple so it's easier to focus. And most importantly, let them do what they can. Supporting independence, even in small ways, builds dignity and confidence. So if a fall happens, the most important thing is to stay calm. For someone with dementia, a fall can be scary or confusing. Start by using simple, gentle words. Something like, "You're safe, I'm here with you." Then, check the area for safety and ask if they're hurt. If they seem injured, call 911 right away. There are 2 safe ways to help them up. The first is the chair method, where you coach and reassure them step by step. The second is physical assistance, but that should only be used if both of you are safe. We'll watch a short video that shows both methods. You'll notice how calm reassurance and slow step-by-step coaching makes all the difference.
Falls happen. We need to respond and not just react. A reaction would pretty much look like this, saying get up or pulling them, which is not a good plan. Let's look at options that are better. First, calm and reassure them and help them get their shoes on before getting them up. Option 1 would be to place a chair behind them and help them to position themselves to pivot around. Cue them to get up on their knees and to take support to pull themselves up, turn, and sit comfortably. Option 2 would be to ask them to bring their arms in as you squat down for a safe lift. Ask them to shift from behind to build momentum so that they can push themselves up with your help.
So let's review. Once you know the person isn't injured, we start with the chair method, which is what we'll practice today. Place a sturdy chair near their head. Start by reassuring, "You're safe, let's go slowly." Then coach them to roll onto their hands and knees. Encourage one small step at a time with pauses. Guide them to crawl toward the chair, place their hands on the seat, and slowly push up until they can sit safely. This keeps them in control, builds confidence, and reduces fear. If the person can't crawl or push up, you might need to give more physical help, but only if both of you are stable and safe. You're going to squat down beside them, ask them to bring their arms in, and shift your weight together. If at any point they seem fearful or resist, pause and reassure before continuing. Calm words and patience are key. Before we move into the practice session, let's take a moment to review the key takeaways. First, behaviors often have triggers. When something happens, take a step back and thinking about 3 areas: the person, the caregiver, and the environment. Second, use calm, clear, and simple communication. Your tone and pacing matter just as much as your words. Third, try combining strategies. Use words, nonverbal communication, and cues together. These layers help the person understand and feel supported. And finally, patience and reassurance go a long way. In every situation, safety and dignity comes first. In the next part, you'll have a chance to practice these strategies in small groups. As you do, pay attention to how your words, body language, and timing can shape the interaction.